Number 2, Chapter number 17. Infection Prevention and Control, Protective Mechanisms and Asepsis. Items will be covered from 10 to 13 out of 50 MCQs. 1. What are some first line of defense against infection? Skin, GI tract, respiratory tract, reproductive tract, eyes and mouth. 2. What are some second line of defense against infection? Fever, leukocytosis, phagocytosis, inflammatory response, and interferon. 3. Describe asepsis, making environment free of microorganisms. 4. Describe medical asepsis, reducing number of organisms present or risk for transmission. Prevent reinfection of patient and spread from person to person. Clean technique. 5. Describe surgical asepsis, preparing and handling materials in a way that present exposure to living organisms. Sterile technique. 6. Describe stages of infections, incubation period. Organism enters the body, lasts until onset of symptoms. Prodromal period. 7. The most common method of microorganism transfer from one person to another in a hospital is prevented by disinfecting instruments in special solutions, filtering the air in the hospital, changing bed linens daily, performing hand hygiene thoroughly and frequently. 8. The nurse is caring for a patient and pays close attention to the condition of the skin. The skin is the first line of defense and protects the body by select all that apply, repelling microorganisms, providing an intact physical barrier, secreting bactericidal substances, releasing macrophages, shedding dead cells. 9. The nurse is caring for a newly admitted patient who is admitted for pneumonia. The nurse knows that the means to decrease the susceptibility of individuals to infection include select all that apply, discouraging visitors who have an infectious illness, using gloves and hand hygiene technique properly, giving antibiotics prophylactically at the time of surgery, providing immunization as available, promoting good nutrition and adequate rest. 10. The nurse is caring for a patient with a wound infected with a multi-drug-resistant organism, MDRO. Drug-resistant microorganisms are a problem within the community as well as within the hospital because of select all that apply, overprescription of antimicrobial agents by healthcare providers, lack of proper sanitation within communities, discharging patients with infected wounds before treatment is complete, patients who stop taking antimicrobial agents as prescribed, overuse of inappropriate antimicrobials causing mutations in microorganisms. 11. The nurse is caring for a febrile patient in the hospital and is concerned that they contracted an HAI. The nurse knows that all hospitalized patients are at risk for HAIs, but which are at the highest risk? Select all that apply. Patients with an open wound or surgical incisions, patients on chemotherapy, patients with an indwelling catheter, patients with a chronic illness, patients hospitalized more than twice in a month. 12. Medical asepsis differs from surgical asepsis in that surgical aseptic technique is used only in the operating room, kills all microorganisms, aims to prevent transmission of all microorganisms, aims to prevent transmission of only disease, producing microorganisms. 13. Considering the chain of infection, a vector might be an uninfected patient, Staphylococcus bacteria, a tick carrying Lyme disease, a contaminated water supply. 14. An infection may result in illness and disease. Select the correct answer from the following about infection. An infection is a congenital disease. Infections may be caused in the hospitals only. Human body is resistant to infection. Infection is the entry of an infectious agent in the body that multiplies and disrupts its integrity. 15. Select the correct answer from the following about bacteria. Bacteria are multicellular microorganisms. Bacteria are single-cellular microorganisms. Bacteria cannot die. Bacteria are multi-organic agents. 16. You are teaching a class on infection control to the newly hired CNAs. One member of the class tells you that they heard that even with hand washing, not all microorganisms can be removed. They then ask you if these organisms are dangerous. In formulating your answer, you recall the fact that there are non-pathogenic organisms present on and in the body called ____________________.